Despite progress being made, the number of coronavirus cases continues to grow. Globally, we now have 3.68 million confirmed cases of the virus, with total deaths now surpassing 250,000. Here in the US, we have now passed 1.2 million confirmed cases and over 71,000 deaths. For more, let's bring in Anjali Khemlani. Anjali, these numbers are upsetting. They continue to grow, although we are still seeing that we're flattening that curve that we keep talking about because of social distancing. With all of this going on, the White House is reportedly going over plans to phase out the coronavirus task force. This is leaving a lot of people, including me, scratching our heads. Why is this, and what is the plan that they're putting forth going forward?
Right. So we're unclear about the full plan going forward. They do say that they're winding down probably by the end of this month or early June. And what that is going to do is sort of create more room, I think, for access to a lot of the health officials that have been wrapped up in this task force. Simultaneously, the White House has reiterated that it was not intended to be a long-term group, but they did do their part in terms of trying to create a streamlined sort of process for testing, for therapeutics, for putting attention on on ventilators as well, and we've heard about all the efforts to bring in the equipment. So what happens to all of that is the question. How does this affect the states? While they have really, banded together in some regions and in some pockets to look at reopening and look at sharing best practices and what's going on, there was, an understanding that the federal level did sort of establish itself. The White House, that task force did establish itself as a lead on guidelines and a lot of other things. But you have also seen the states sort of operating separately. So what does that do in terms of the power balance, as well as where do decisions come from after this is going to be one of the main questions. How will hospitals get access to equipment if need be? Because we do know that in some parts of the country, we are seeing steady rises in cases. Whether or not that will reach the surge level that we saw in the New York, New Jersey hotspot remains to be seen. But this does leave a lot of questions still on the table, unfortunately.
And I'd imagine our states' governors are also scratching their heads. What does it mean for local governments if this task force is disbanded? Is it really sort of, every state for themselves at that point?
Well, they already have been operating that way and claiming to be operating that way. We saw the example of Governor Larry Hogan and having to get those tests from South Korea, those testing kits from South Korea. I've talked to a couple of county level executives who have said they've also started making calls internationally to try and secure supplies as they stand up testing sites and as they need more equipment for the local area. So it seems like that has already been happening because there was always sort of that tussle between the federal and local governments on who gets access to some of this stuff. So it may just be business as normal, or even empower more the states and the local governments.
All right, Anjali Khemlani, thanks for that.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.